Rapidly advancing technology continues to drive digital transformation across all industries. COVID-19 and its impacts have further highlighted the critical needs in our communities for better healthcare for all, especially those in disadvantaged communities that have not had the same quality and access to care in the past. For our June 15th Innovation Series, we will focus on 3 critical emerging technologies: sensors that are created by the Internet of Things, machine learning, which allows us to understand all the data created by those sensors, and finally, augmented and virtual reality, which allows us humans to understand the data and the analytics created by this increasing number of sensors that are in our world today. These emerging trends have the opportunity to serve as a catalyst for better health, wellness, and most importantly, stronger communities across our state. Advanced sensors will continue to accelerate telehealth solutions by evolving to provide very low cost but trusted medical devices. Sensors are a key underlying technology for the Internet of Things. They continue to get smaller, cheaper, and much more powerful to understand the world around us and to blend into our environment. Consider that in your home, your office, and even your car, there are a multitude, hundreds if not thousands of sensors that are constantly monitoring location, condition, and status. If we just take a very practical example that we're all familiar with, when we get into our car and our Bluetooth-enabled smart device connects to the Bluetooth-enabled car, Google Maps magically knows the time of day, our most prevalent behaviors and locations we drive, and then, like magic, gives us directions to our location. Consider if we had that same capability for healthcare. Emerging solutions like microfluid and MEMS and even DNA sequencing on a chip are evolving at a rapid rate. This will provide us an opportunity to provide real-time health insights, care, and most importantly, a very cost-effective means to supporting a larger number of patients and communities access to higher quality but lower cost healthcare. The proliferation of sensors will create tremendous amounts of data that we will need support in to understand and, more importantly, make informed decisions on. This will require machines, computers, to understand not only images, but the spoken voice as well as the written word, not just in English, but across multiple languages and dialects. This is the essence of machine learning. And it comes down to 2 very distinct branches. One is computer vision, a machine's ability to understand images around it, as well as natural language processing, which gets into the ability for computers to understand both the written and the spoken word. We see these today in our homes with things like Google Home or Alexa. That is an example of natural language processing. Our security systems such as Ring that can detect if somebody's walking on the sidewalk to our house or actually approaching our house rapidly to steal a package, be able to analyze that image and determine if there's a threat is another example of machine learning when it comes to computer vision. Now, these solutions today are applied in a wide number of ways within the healthcare system, whether it's the ability to read x-rays, MRIs, CT scans, and other imaging solutions, or to be able to help with transcription services to put critical patient information into electronic healthcare records. But consider what will happen tomorrow. Think about a very highly intelligent agent that can understand the world around us and what they hear and see, to be able to process all this sensor data that we talked about before, that is collecting enough information on a physical every single day of our lives, and then be able to analyze and to recommend both healthcare and treatment for us that will improve not only our individual health, but as we look more broadly at community health in the future. How will we understand all this new data and insight that is created from sensors, from machine learning, and how we as humans will be able to consume this information and to make informed decisions? Augmented reality and virtual reality are 2 approaches that will help us solve this problem. Augmented reality is very simply being able to overlay information and data to project it onto physical objects. This is similar to games that your kids may have played, like Pokemon Go. Virtual reality are these headsets that immerse you in a digital world. And another example from the gaming industry is the Oculus systems that many kids have today. Now, these tools are being used for business and healthcare solutions even as we speak. Virtual reality is creating synthetic training environments to be able to teach people not only about nurses' procedures for certification, but how to engage in an emergency room between community members, patients, family, police officers, or other emergency personnel, and physicians. And this is a very complex social situation that our healthcare workers need training to understand and respond with empathy. They're also being used to plan surgeries. And most importantly, VR is being studied today as a way to eliminate opioids from pain management. There are studies that are showing that VR is a great approach to being able to manage pain in many different situations. It is also a great communication and educational tool. While augmented reality is being used to overlay surgical information on top of patients or to help with teleproctoring opportunities for robotic surgery. Not to mention how it can be used in a facilities management approach to be able to improve the maintenance and the overall operations of a hospital environment. These solutions will provide a critical means for how we as humans understand the world around us. These technologies all offer tremendous promise. However, there are still emerging trends and technologies that require leadership, investment, and most importantly, agile testing and experimentation to be able to realize their full potential. We have a tremendous opportunity in front of us to be able to address some of the stemming and historical issues that we have with access to healthcare, and more importantly, provide a better experience for all Georgians and beyond when it comes to high quality, low cost, and most importantly, effective healthcare. There's a tremendous opportunity in front of us to be catalysts for transformation and to make a real difference in our communities and in our loved ones' lives. We look forward to having you participate on June 15th and really engage with us in the Innovation Series to transform not only healthcare for Georgians, but more importantly, beyond.